This is the year we've been wondering and worrying about the baby boomers officially begin retiring, and they retire in record numbers. Every day, 10,000 baby boomers turn 65, and that's going to continue for the next 19 years. Terry Berry calls this a tidal wave that's turning into a full-blown tsunami. Here she is to point out the impact this will have on a variety of government and social service programs. Terry's the CEO of Meals on Wheels for Stark and Wayne counties, as well as the immediate past chairman of the Meals on Wheels Association of America. Thanks for joining us today, Terry.
Thank you for having me.
All right, so Terry, you're trying to wake people up to the stress that the growing numbers of older people will have on social service programs.
Well, the one thing that's really important that we all need to recognize at this point in time is we knew the numbers were coming. It's obvious. We've known it for years. And those of us in the aging field and the government itself, we haven't put our heads in the sand and ignored it. I mean, years ago you had Social Security that was formed. At that point in time, life expectancy was 68. Now it's 78. You had Medicare, Medicaid, and what they were looking at that point in time was an income. Incomes have changed dramatically the same way the senior has changed dramatically. Our seniors today, they have planned for retirement. And those of us in the social service network knew they were planning for retirement, unlike their parents. What has really thrown us for a loop and thrown those that are retiring or hoped to have retired and now can't is what's happened to the economy here in the United States in the last 5 to 6 years. And those individuals who 4 years ago may have had a 5-year plan to retirement, their plan to retirement has maybe changed to 7 or 8 years because they've lost their investments. Their income has stayed stagnant in their highest grossing years, which means their Social Security is going to be less.
How does the change in the healthcare the whole healthcare area, especially with the new federal law, impact seniors in their retirement? Will that make it easier?
It's interesting because one of the things is we don't know how the new health care mandate is going to affect us and affect the seniors themselves. What we do know is the change that's coming down that's regulating hospitals and nursing homes. Some of it's good, some of it's bad. Those seniors retiring now, they're looking at staying home as long as possible. So they're looking for assistance in home care. They had looked at a time where and planned for a time that they could pay or at least help pay towards the cost of that. Look at their retirement dollars, their investment dollars that have tanked.
What's the Older Americans Act?
The Older Americans Act was formed back in the early 60s, and what it was because people had not planned for retirement, kind of along the lines of why Social Security was formed. And the Older Americans Act started primarily wrapped around what we call today as congregate nutrition. It was when people had not planned for retirement and you were hearing the horror stories of the widow eating animal food because they couldn't afford anything else. So the idea was to put in place a service geared for those 60 years of older that would offer proper nutrition, that would offer some home care, transportation, and then also recreation, that type of thing, because we know how important that interaction is.
So it fills in a lot of the gaps that you would have with Social Security, Medicare, Medicaid?
Well, it does. It fills in the gaps. But the other thing, too, is that what we've looked at is with the individuals planning for retirement, planning their income for retirement, but now it's not there because of the economy. What they were looking at is that they haven't been funding it to the level it needed to be funded to assist those of us in the not-for-profit area with this number of seniors that are retiring daily.
You've got this huge new numbers of people coming into the system, needing more help with income, with health care, with food, nutrition. What can we do to make sure that there'll be sufficient benefits to help make sure that people don't starve, to make sure people don't go without health care?
I think we all need to stop being so rigid. I mean, I think it's everything from private industry to government. We need to look at innovative ways of assisting individuals to stay at home as long as possible, but including the families in that. We need to look at private not-for-profit partnerships. It all can't fall back to the government. It's real easy. You're an elected official for everybody to turn around and start screaming at the government, but look at your budget. What are you guys going to be looking at when you go to Columbus? You're not
Right.
getting the income,
Stressed, absolutely.
and
No
everybody
question about
is
it.
that way. So we have to learn to work together.
All right. Well, thank you very much, Terry. Good information about things that I'm not sure people know about, and that's really coming down now. Terry raises some very valid and troubling concerns. Now it's up to us to learn more. We have to learn more about these issues, and we have to work with the government to make sure the government knows how we feel. So talk to your state and federal representatives. Personal lobbying, it works. Let them know what you're interested in, what you want to know more about, and how you feel. If you're a member of AARP, follow what they're doing to advocate for senior issues. My thanks to Terry for giving all of us a wake-up call.
For information, call Meals on Wheels of Stark and Wayne counties at 1-800-466-8010 or check out their website at www.mow-starkwayne.org. Next, protect your life savings from lawsuits.